Our next presenter, who is likely familiar to most of you as well, her name is Caron Gan. By training, Caron is an RN, and she's also a registered marriage and family therapist. She's a certified clinical traumatologist who holds an adjunct lecturer appointment at the Lawrence S. Bloomberg facility in nursing at the University of Toronto. For the last 22 years, Caron has provided psychotherapeutic intervention to adults, to youth, couples, and to families following an acquired brain injury. Through the Bloorview Research Institute, she's conducted studies on the effects of ABI on families, and she's published numerous articles and papers on family assessment and intervention. It's interesting to note that Caron was a lead developer of the brain injury family intervention for adolescents, and she has been active as a trainer in both Canada and the US for that program. So it's my pleasure now to introduce to you Caron Gan.
Thanks very much, Leonard. It's really hard to follow an act like yours, Glenn. So I'm not even going to try, but I'll do my best. And I want to say, even though your teeth cost $10,000, you have $1 million smile. That was an awesome presentation and $1 million sense of humor, so thanks so much. I'm here with my Holland Bloorview hat on, and I'm going to be talking about what families go through after brain injury, and I will cover both adult as well as pediatric experiences. I'm going to start off by talking about some of the common myths and misperceptions about families after ABI, and to underscore the need for family system intervention. And I don't think any of you would disagree with that, so I'm preaching to the converted already. And also I'm going to introduce 2 empirically based family system interventions after ABI. So since this is a back to school conference, I thought it would be a good theme to follow on myths and misperceptions after ABI. And I want to acknowledge some of my colleagues where some of this is taken from. We authored a chapter on families after ABI for the Academy of Certified Brain Injury Specialists. And so this is in press right now. And in part of that paper, we are talking about myths and misperceptions. So I want to acknowledge some of my authors on this. Myth number 1. It is not necessary to work with families after TBI. The focus should be on the survivor. And I don't think any of you disagree with that. We heard from Dr. Sayon this morning about the importance of paying attention to the families. They are the major support for the individual after the brain injury. And there's been numerous studies published on the long-term effects on family system functioning. And we also know that there's a direct correlation between how the survivor does and how the family manages. This is a very old study, but my colleague Dr. Kreutzer uses this a lot in his presentation, so I've borrowed these slides from him. As you can see here, in terms of rates of depression after brain injury, isn't it interesting that wives report a higher incidence of depression, more so than the individual with a brain injury? And mothers are up there as well. Same thing with irritability after brain injury, anger after brain injury. And so what this underscores is that it's not only the person with a brain injury who experiences all those psychiatric sequelae that Dr. Sayon was talking about this morning, but family members do as well. And what I have been learning and realizing more over time in my work at Bloorview is the number of parents who are experiencing post-traumatic stress symptomology. And then in my private practice, I work in the community, and what I'm noticing also is how so many families even years after the initial event, are presenting with unresolved trauma symptoms that have not been diagnosed, that have not been treated. And so it's really important to track how family members are doing over time as well. Myth number 2, family members have more insight and resilience than the person with a brain injury. And often that may be the case, but we also know that family members also need to maintain a lot of hopefulness to keep them going. And with the care demands that come with brain injury, that really taps into their ability to maintain their resilience. Dr. Kreutzer developed a graph of some of the work of Muriel Lezak, where they looked at the rates of recovery along with how family members react to that injury. And so as you can see, it starts off with initial stages of hope that the person is alive, and after the person goes home, they're just happy that the person's home, and there's a lot of hopefulness that, hey, in a year's time, he'll be back to normal. But then over time, when they realize that the person isn't back to the way that they were or that they had envisioned, then some of the grief reactions begin to set in. And Muriel Lezak's work talks about how around the 3-year stage of recovery, that family members develop some more emotional reorganization. But I would challenge that based on my clinical practice. I see many families 3 years, 5 years, 7 years post-injury, and they're still very challenged by the ongoing difficulties that they have to face. And I'll talk a little bit about a different model to consider. But the research shows that family strain and psychological distress is really high, 47% of relatives. Negative life change reported by 67% of spouses or parent caregivers. Look at the rates of depression in spouses, 73%, anxiety, 55%. And how often are these spouses able to get help for what they legitimately need? And 47% of caregivers had altered or given up their jobs at 1 year post-injury. So this really speaks to the economic strain on the family and increased use of alcohol and medications. Often we worry about substance use in the individual after a brain injury, but we also have to pay attention to potential substance use difficulties with family members. So that's just something to be cognizant of. This chart I find fascinating. If you look at the problems most frequently reported by relatives, there's not a whole lot of difference between 1 and 5 years post-injury, is there? If you look at the personality changes, irritability, temper, tension, and anxiety. But look at that last point, threats of violence. At 1 year post-injury, 15% of relatives were reporting that. But it jumped to 54%, 5 years post-injury. And there's a lot of speculations around why that number is so high. But it really speaks to the need for ongoing intervention and learning ways of being proactive in dealing with issues around aggression. And Dr. Seon's talk this morning also talked about the incidence of chronic aggression and the need to have a multidisciplinary component to treating that. So this speaks to safety issues that we have to address as family therapists. With family needs after brain injury, there's often unmet needs around health information, professional support, and community support. And we heard from the social workers this morning around the need for that kind of information. But it's not just at the acute care stage. It's ongoing because people hear information differently depending on the stage of recovery. Unmet healthcare needs are associated with increased burden. So the more we pay attention to attending to those needs, that helps to lessen the strain and the burden for the family members. We also know that as physical and cognitive recovery stabilizes, that's when the psychosocial issues emerge. So I see the first stages of rehab often around the physical components, and the psychosocial issues really intensify more over time as the grief issues set in, as people realize the persisting challenges and, this is the way life will be. And in a recent study with the pediatric population, it was interesting that 2/3 of those parents reported unmet needs around information, medical support, family support, and return to school. And this is 2 to 4 years post-rehab. And I think our public health care system really falls short on the community-based end of supports, and that's where we rely on the private practitioners when there is the benefit of accident benefits. But for those of us who work in public systems and people don't have that, it makes it really difficult to provide ways of attending to those needs. Myth number 3, families require short-term intervention. 12 to 15 sessions should suffice. How many of you have heard that? In the old DAC system, I would submit treatment plans after 12 to 15 sessions for family members. And then I would get somebody who would do an independent medical and say, well, 12 to 15 should be enough. Why do you need more? And I would go to town on that and use all my research to make an argument. Unfortunately, I can't do rebuttals now, so I don't have anything to kind of help myself feel better for that. And so it really requires education of the system, the insurance system, and the people who make the decisions around short-term intervention. So family burden doesn't necessarily dissipate over time like other situations. If you look here, families who reported low burden, there were fewer of them over 5 years. But look at the high burden over 5 years, that intensified. And research has shown that it can remain significant at 7 years post-injury, and some studies have even looked at families 10 to 15 years post-injury, and it's the same. And it's the physical changes that cause the least burden. It's the emotional, behavioral, and personality changes that add to the greatest strain for the family members. So earlier I talked about that, I showed you that graph of Muriel Lezak's, which shows families reorganize after about 3 years. This has been more of my experience with families after brain injury, that there's this initial event that causes a lot of grief and trauma initially, but this gets reactivated over different parts of the life cycle. So the birthday may be a trigger time for the families, the time when the child would have graduated from high school. That can be a trigger event for the person with a brain injury as well as for the family members. The anniversary date, getting married, the time when children would have been launched from home. But anything can trigger these loss reactions for families. And what comes to mind for me is how a mom talked about how even going on the subway triggered loss reactions for her. She would see all the young people riding their subways with their backpacks, how they're sort of pushing everyone aside with their backpacks and everyone's really annoyed. But for this mom, that struck a chord for her because she knew her child would never be one of those annoying teenagers with his backpack. And so any little thing can set off grief reactions for families. And so when adjusters are saying 12 to 15 sessions, how can you put a timeline? You got 3 months to go through the stage of denial, you got 3 months to go through the stages of anger, and then, by 15 sessions, you should have resolved your grief and loss. So they don't get it. We need to do a lot of education, and all of you are on board around this because you have experience working with families. And so this is more to use this information to educate the system, to educate administrators, to educate insurance systems. And when you're working with kids with brain injury, we wrote a chapter around the need for a life course perspective. Because children's brains are still developing, and we know that their recovery patterns differ from adults. They often grow into their disabilities. We also know that adolescence is the time of heightened vulnerability. And they don't have the opportunities to develop the life skills that other children do. So, when they become adults, they are still adults with brain injury. So we need to really build in for the supports for these families over the life course. Myth number 4, children who sustain brain injuries recover more easily than adults because of neuroplasticity. And we know that adolescent brains are works in progress, and those of us, like myself, who've survived adolescence, it does get better. Now, the research is showing that the timing of brain injury in childhood is really important because that affects the recovery. And some of the earlier research talked about how the preschool ages are the most vulnerable. So if you're injured before age 5, that's the greatest time of vulnerability. But this article that I found written by Crow and her colleagues in Australia, they actually found that children injured in middle childhood, 7 to 9 years, were particularly vulnerable, more so than those who were injured preschool. So I found that to be very interesting. So people can look up that article if you want more information about it. Impact of TBI on families with kids. It's similar to the adult literature. Significant levels of anxiety and depression, psychological distress, burden, work and finances. Myth number 5. And this is what insurance companies don't understand as well. Involvement of the entire family is not critical to the rehab process. How many times have you heard that from adjusters? We do know from the research that there's a reciprocal influence between how the family members do and how the child does. And so if the parents are more stressed, it's associated with more negative outcomes in the child. So we need to reinforce how they go hand in hand. If you want to improve outcomes for that child or for the person with a brain injury, you need to pay attention to the family, because we know that family roles change, and there's, if there's a breadwinner in the family who was injured, there's a loss of finances, someone else has to pick up the slack, maybe the mom has to go to work, kids take on additional roles. With issues around aggression, there's safety issues, family strain, finances, social isolation. And we do know that the caretaking demands are prolonged. It's lifelong living with a brain injury. And in terms of the spousal system, often people talk about the loss of partnership and the loss of companionship because the person that they married is not quite the same. And it's not uncommon to hear spouses talk about their experience as if they're married to a stranger, because physically the person may look the same, but psychologically, personality-wise, that person's experience is quite different. And that disrupts the equilibrium in a marital relationship, which impacts the rest of the family system. Now, when you have a parent who's injured, there's a loss of parental authority, and their ability, how do I go backwards? Their ability to take on the parental roles may be diminished or compromised as a result of the challenges with a brain injury. And it's not uncommon for the parent who has the injury to talk as if they feel like they're being treated like a child. And that's a horrible experience for that parent. And so part of the work is helping that injured parent learn to take on new roles that fit within his or her abilities. And for the non-injured parent, we often hear about divided loyalties, and that they're juggling having to be the case manager, the therapist for their spouses, but also having to deal with the medical system, dealing with legal systems, and having to balance the needs of the children in the family. So it's a huge burden on the non-injured parent. And it's not uncommon for them to experience discipline problems because that parent has lost the support of the other parent in managing the children. So it's not uncommon to see behavioral issues emerge with the kids. And often these parents talk as if they feel like they're working like a single parent in that family. And also the report that I often hear from parents is that it's like having another child in the family, and that's not intended to diminish the person with a brain injury, but that's the experience that they feel like because of the care demands. Myth number 6. Children and siblings of survivors do not need to be involved, as they are unaffected by the injury. And we know that's not the case. They may be suffering in silence instead. The research shows that siblings are definitely impacted by the brain injury. Emotional reactions, school problems, increased responsibilities. They also need to understand what's going on with their brother or sister. And often because the parents are at the hospital with the injured sibling early on, it's not uncommon for siblings later to feel, hey, who's there for me? And, I've been introduced to siblings who have been many years post-injury who talk about how, I felt abandoned by my parent. Mom was at the hospital all the time with my brother or my sister, and I had to be, shuttled off to my grandparents. So these siblings, even though they may not verbalize it or complain, they feel the profound effects of how the family has been disrupted by the brain injury. So these siblings, sometimes they may be the target of inappropriate behavior by the injured siblings. They have added responsibilities. They may take on a role reversal. And we know that there's very limited supports for siblings. Now, when you have a parent with a brain injury, it's quite similar. And there's even less research on children who have parents with brain injury. In this particular study, 90% of that sample, huge, 90%, reported negative behavioral changes. And what's interesting is that the parents were also reported as being more lax in discipline. And that kind of makes sense, because if the parents' energies are focused on attending to the needs of the injured relative in the home, they only have limited resources. And we know that disciplining kids takes a lot of emotional resources. And so sometimes this goes by the wayside. And non-injured parent is less actively involved, increased rates of depression. And so children who have a parent with a brain injury may experience fear around the personality and behavioral changes, especially if they have not been educated around why daddy's different or why mommy's different, why they can't do the same thing anymore. So they need to be involved in education right from the get-go. Role changes. It's not uncommon to see the oldest child in the family step up to a parent role. And you'll see a video about this in a moment. Their relationships with their friends may be compromised because they may not have the time, or there may be embarrassment around bringing their friends home. And because the non-injured parent is so busy, there's fewer positive interactions with both. So not just the injured parent, but also the non-injured. So the child often experiences a loss of both parents. So I have this video which I'm going to show, and it's quite an old video, and it was taken by a horrible videographer. That's why I'm a family therapist. But I've tried to replicate the stories of these two young people. One is the sibling, the sister of someone a teenager who had a brain injury, and the other one is the daughter of someone who has a brain injury. And so when I'm talking about family experiences after brain injury, the best way to exemplify that is through the stories of the young people themselves. So if you can show the video, please.
Well, as you know, my name is Caroline, and my brother's the one who has the head injury. He had a car accident about 6 years ago, and it has changed our life a lot. We've been through a lot, but I think it made our family a lot stronger. I think my brother was obviously the main focus in the whole situation, and he went to rehab, to hospitals, everything, name it. And I was just in the second year of high school, and I couldn't focus at school. I did ballet. I dropped that. I played soccer. Nothing was revolved on our family. It was just towards my brother. And all of a sudden, he came home from rehab and from like programs and support groups. And my brother and I used to be really, really close, but it just tore us apart. It made it even worse because my brother started getting very angry. He couldn't accept the fact that he had a head injury, and he didn't know what it was. I didn't even know what a head injury was or a brain injury. No one knows what it is. You see my brother, he's physically fine, but mentally he's not there. And the doctors even said, you can't fix a brain. We can make it better. So my brother went away to St. Catherine's, and in a way it was better for me because it was just the three of us, and my brother and I used to fight all the time. My brother was very abusive towards me, and I guess I was just the target. I guess I was the target to him, and I don't know, he was just filled with anger, and I was wondering why. Why is he so angry? 11 months after St. Catherine's, he came back home, and it even got worse. And he started being more abusive towards me, and I ended up leaving home. I didn't come home at night. I'd stay at my friend's house, and my mother and father was always worried about me, but also worried about my brother, and it's not fair. So my mother and I decided to go to a support group, which helped me a lot. I've done a lot of talking. I've expressed my emotions a lot, but I've been through a lot, and my family has, but it made us really, really stronger, this whole thing. But about December, my brother and I we get along, but we don't get along as a brother and sister should be. So I decided to move out on my own, and I'm only 21 years old, and I'm thinking like, why do I have to move out of my house? Because of my brother. But I totally understand the fact that my brother he's sick. He needs to deal with the situation, and the only thing we can do is to help him, because like I said, you can't fix a brain. And now I left home, but I think my brother and I are becoming really closer now, and he's actually coming over. We're doing more things together, and because of my mother, I think she's like the man of the house. She's the one who made our family together, because all four of us have drifted apart, but we've come together as one. Even though we're separated, we've both become really close. And learning about head injury has taught me a lot of responsibility, a lot of sharing, a lot of giving, not about myself, but about the person. That's about it.
Okay, hi, I'm Hannah, and my mom suffered a brain injury a few years ago, 8-9 years ago, so that was quite a while ago, but even now she still hasn't fully recovered, and I don't think she ever really will. When she actually got this brain injury, I didn't understand what it was for the first maybe 5-6 years. I understood for the first 3 years, I actually thought it was a stroke because that was all I knew about brain injuries. Like, that was about as far as I went. But like a few years ago, I learned that she actually had an aneurysm, which is like something to do with stress. Anyway, yeah, so the brain injury itself, at first, it kind of drew my family apart. Like, it drifted apart because my dad was under like a lot of stress. My mom was like off in hospitals and rehab and support groups. And my brother, like I have a younger brother, he's 3 years younger than me, and he actually, like, he didn't know where his mom was. Like, he used to get really upset and stuff, and then he sort of took it out on me. But I actually had to be his mom for like 3 years that my mom was in hospitals and stuff, and that taught me to grow up like a lot faster. I grew up a lot faster than a lot of my friends, and in a sense, I feel that the brain injury took away part of my childhood, but that's okay with me because, like, my mom, she's completely like responsible and she forgets stuff like she used to. She still doesn't have quite as long as like an attention span as she used to before the brain injury, but she's getting a lot better, and she's supposed to be here, but she's not, but that's okay. Anyway, yeah, so just in conclusion, I'd like to say that the brain, like, kids it helps a lot when we know exactly what the brain injury is and what we can do to help them. I received a lot of help from like Caron and at the other like family support group here at the Misconceptions Center, and ever since I sort of got that help, I've learned to accept the fact a lot more. Like before, I used to sort of deny it a bit and be like, oh yeah, my mom's okay. But anyway, yeah, so it just helps kids grow up a lot faster when a close family member, especially like a parent, has this brain injury, and just learning about it helps us deal a lot more with it. Thank you for listening.
So that workshop was held many years post-injury for both young women, and the profound impact on them talking about their story is so poignant. And so how can this be resolved in 12 to 15 sessions? I'm still thinking about that adjuster who denied my treatment plan. So find ways to involve everybody in the family. I know we're doing a lot better job of involving the caregivers, but let's not forget the children in the family as well, because clearly the research as well as the stories of these two young women underscore how profoundly affected they are, and they may be suffering in silence. So myth number 7, the brain injury is the cause of all family problems and is the only goal that's important in rehabilitation. And we know that the brain injury is not the only thing. And sometimes when we're dealing with such complexity of issues, some of which may predate the injury, but we're also dealing with unemployment, mental health issues, substance abuse. It's really, really complex. And so this is not the kind of work we can do by ourselves. And that echoes what Dr. Sion was saying this morning. And it does require looking at the needs of every member of the family and what are the psychosocial issues that they bring to the plate, because there may be a lot of issues that predate the injury, but it doesn't mean you ignore it, because if they're exacerbated by the brain injury and that affects the recovery process for the person with a brain injury, how can you compartmentalize it and not deal with it? So as a family systems therapist, I treat the whole family, and I treat everything that the family brings to them. And even though my focus is supposed to be on the brain injury, I can't really ignore the other salient issues that are impacting on how that family is reorganizing. So that may require collaborating with mental health professionals, domestic assault programs, children's mental health centers, and so that collaboration is something I really like to underscore. So, just to sum up, how can we be proactive around the needs of families after brain injury? Number one, involve other members of the family around the TBI education, especially the kids, and start that in the early stages because they're often excluded from that acute care experience. And if you can find child-friendly ways of introducing the brain injury and providing that education, that's a way of engaging them right from the outset. And we heard from the social workers this morning around the need to provide information and education, but that needs to be done on an ongoing basis. The way that the families hear that information at the acute care stages changes dramatically after they go home, after they've had the lived experience, 2 years post when reality sets in. So families need access to information and education about what it means to live with a person with a brain injury many, many times over that life course. And it's also helpful to provide information around some of the information that I provided you today because it helps to normalize for families that what they're going through is quite common. It's normal for brain injury. And for a lot of the family members that I work with who may be experiencing depression or anxiety and would benefit from medications, they say they don't want to because there's nothing wrong with them, they're not the one with a brain injury, et cetera, et cetera. I just pull up my research statistics and I tell them, and I say, well, in fact, you would be amongst the majority of caregivers if you did need medications. And so that kind of brings a sigh of relief for them that it is so common. And as we heard this morning, it's also important to link people to some of the brain injury resources like BIST, like OBIA, or wherever other community supports you might be in. And encourage family members to support groups because it really helps to lessen that feeling that you're alone in this. And assess the needs of the family system and every family member, including the children in the family. And the last point I want to underscore is put in separate claims for the family members and do that early on. Far too often, when I'm pulled into a private file in my private practice, I ask, is there a separate claim for the family members? And many times there aren't. And so we need to get the disability certificates completed. And so it can just save a lot of time if these claims can be put in right at the outset. And I've also, and if it can be done by people even, I don't know if it can be done in the rehab stages while they're still in hospital, if physicians are willing to do that, because I've experienced family doctors unwilling to complete that disability claim saying, well, they're not the person with a brain injury, so they don't get it. And when I try to speak with the family doctors around, yes, this caregiver is not the person with a brain injury, but they're dealing with these issues. And so it really saves a lot of time if this can be done much earlier in the process by people who understand the needs of family members. So I just want to sum up by talking about 2 empirically based family system intervention programs that have been developed. And many of you are familiar with this. One is the Adult Brain Injury Family Intervention developed by Dr. Kreutzer in Virginia Commonwealth University, and the adolescent version we developed at Holland Bloorview. And so we do workshops once a year around brain injury training, brain injury family intervention training for professionals. And I found out about half an hour ago I made a mistake on this slide. I was not obsessive compulsive enough. It should be 2014, not 2013. So our next training is coming up next April, And these are 2-day intensive training workshops for professionals around working with families after brain injury. And so it's not necessarily to learn to be a family therapist, but it's to have tools that you can use even as a case manager when you're working with families. You're trying to engage them in family work. And there are many skill-based modules that can be helpful as well. So far we have trained over 250 professionals from Canada, US, and Sweden. And we did some outcome evaluation of that training and found that there were statistically significant improvements in participants' ratings of knowledge, confidence, and skills. And so we're really pleased by the outcome of the training. So if you want to be on our mailing list, just give me a shout. My email contact information, I believe, is on the slides. Oh yeah, there it is. So that's the end of my talk, and I think we're due for a break. Is that right?